You're welcome to yet another insightful and interesting episode with Ask Dr. Ken. My name is Kermungukas, and as I've always said, I have someone special with me today, and he is someone we've been talking with for quite a while. He remains Dr. Ken. You're welcome, sir.
Thank you so much.
Well, as most of you are aware of, he's an IVF specialist, and he would be doing justice to some questions I'd be asking him. The very nature of this discussion is to provide a source of hope to women out there, not just women, but couples out there who have been trying unsuccessfully to have children, but perhaps because of one situation or the other, they're not able to do so. So I hope you're watching, and I hope that you're going to learn from the questions I'd be putting forth to Dr. Ken. Once again, sir, it's a pleasure to have you.
It's my pleasure.
Okay. I will be looking at a very important topic, and it's something that I found quite interesting. It's mainly natural cycle IVF. And I remember asking Dr. Ken earlier, wow, like natural cycle, what is the opposite of natural cycle? Is there anything other than natural cycle? Because when I hear natural, I think of herbs. I think of green. Maybe one should go and take a lot of herbs. And I was asking him, and I remember he laughed. So I believe that he's going to help clarify that. Dr. Ken, what is natural cycle IVF?
Yeah, natural cycle IVF dates back to 1978. I'm talking about the first successful IVF in the world. Before IVF took different turns, modifications, innovations, and inventions to the point where we are right now. You know, the first IVF that was done in the world before, the one that gave birth to Lois Brown,
Okay.
was a natural cycle IVF. And by natural cycle IVF, we mean the kind of IVF where no medications are used.
Okay.
You understand? When IVF started, that was the first kind of IVF that was done. Yeah, I know we had a story of a lot of unsuccessful attempts before the conception and birth of Lois Brown that marks the turn in assisted reproduction technology. So in natural cycle IVF, what happens is this, a woman's monthly cycle is being monitored. She's not given any medication.
Okay.
And usually, according to the codes of nature, a woman is meant to ovulate a single egg or at most 2 eggs. In very rare circumstances, 3 eggs, without any modification, modulation, or any stimulation of her ovaries. That's what natural cycle is. So that kind of IVF that monitors a woman's natural cycle.
Wow. Does a woman need to be physically present? Because you said monitoring. Do you need to put her under sedatives or?
No.
Okay.
Monitoring means she comes to the hospital at intervals during this her cycle before her ovulation, where you are scanning. You do some scans, ultrasound scan, to evaluate her follicles. Follicles are the cases or the houses where the eggs stays. You know, so you monitor the growth of the follicles until it gets to the full size of maturation. Then a trigger is given, and the egg that should have been ovulated spontaneously inside her is now retrieved in the theater. You know, and at the point of retrieval, the husband's sperm should be available too, and fertilization is going to be done, and culturing of the embryo is done too before embryo transfer is done. So that's actually what natural cycle is. It doesn't mean the consumption of some herbs, or it doesn't also mean that the other modalities of IVF are artificial. The word natural means the nature kinds of egg production.
Okay.
Yeah, the nature kinds of egg production that follows the undisturbed physiology of the woman. After menstruation, follicular development continues, you know, and gets to about the 12, 14 days of a woman's cycle where ovulation occurs, or earlier than that, where ovulation occurs. But as against allowing the ovulation to be spontaneous in the pelvic cavity, it is retrieved. The eggs are retrieved. Egg is retrieved in the theater and fertilized. And after a few days of culturing, the embryo is replaced in the woman's uterus. So in this situation, no drugs are used, but more recently, some modifications have been done, though, to help in improving the quality of the eggs that nature produces in the woman. And now, with more desire for success, some medications may be administered to prevent early ovulation so that we can actually retrieve a good quality of egg from the woman. That is what natural cycle is here.
Okay.
It cuts off all the loads of medications, the injections, the hormonal medications that a woman is meant to use. And by implication, reduces the costs of the IVF treatment. Because in this part of the globe, for instance, Africa, where little or no drugs for IVF have been manufactured, most of the things used for IVF are imported from either the European or the Asian countries.
Okay.
You cut off the burden of all those medications. And so that reduced the cost of IVF drastically. So with the little amount that some women may be having, they may be able to access the care of IVF under the natural cycle IVF.
Okay.
And the good thing about natural cycle IVF is this: a woman may be able to undergo IVF every month. Every month, because you're not burdening her with hormonal modification or stimulation or hormonal surge at any point in time. The body is just under nature's control. But it produces eggs that you retrieve. And at most you retrieve 1 or 2 eggs. And the beauty of it is this: you have a high chance of having implantation. Implantation rates are seen to be very high with natural cycle IVF because there is no surge of hormonal of hormones in the system, in the physiological system of this woman. And because we observe that or find out through researches that some of these loads of hormone may actually prevent implantation.
Wow.
And since there is no load of hormone in this woman, the chances of implantation may be very high. But the downside of it is that because of poor quality eggs, often that may be gotten in natural cycle IVF, treatment cycle tend to be cancelled a lot.
Okay.
But of course, not much is invested, so not much is lost. And the woman has a chance of undergoing this kind of IVF every month, as against the conventional IVF where loads of medications are used that a woman can undergo it maybe every other month, every 3 months, or even every 4 months, or even whenever she's comfortable enough to raise sufficient amount of money to give it a trial again. So that's some stuff about natural cycle IVF. The beautiful part is that it doesn't put physiological load on the woman.
Okay.
Then with little amount of money, you could go through it.
Okay.
I am.
If I might interject a bit. Now, you mentioned some of the benefits,
Oh, sure.
right? I'll still get back to that in due course. You still tell us more of the benefits. But for now, I'm particularly interested in the opposite or the flip side of it, which is the conventional method. Now, if a patient okay, let me not use myself though. If a patient were to walk into your hospital and recommend, or you were asked to recommend a better process, would you choose the conventional method or the natural cycle?
IVF treatment as protocols are recommended based on individual basis. In one of the series, we talked about individualized IVF treatment.
Yes.
The kind of IVF we recommend to a patient depends on a whole lot. I can't just, in a blanket form, just recommend this kind of IVF because I'm just seeing a patient. I have to first of all take the history of the patient, evaluate the patient, do some investigations, and of course know the religious background of the person, the psychology of the person, the culture of the person. And based on all that, we could recommend the kind of IVF that an individual should undergo.
Okay.
And then if after all of that, this is the kind of patient that would not want to accept all kinds of modality of treatment and is low on funds, then of course, and it's the patient, the client is still in the category of people who produce egg, then the natural cycle IVF may be a good option to consider. Or if the woman, for instance, has maybe cancer, and may not be able to tolerate some loads of medication, natural cycle IVF may be adopted. If you had also tried several kinds of IVF modalities and haven't succeeded, and there's chance that she could produce egg, I may go for a natural cycle IVF. So it is individualized. And I won't be able to say outrightly, because I'm seeing you, you look black, you look white, it's natural cycle IVF. No, you put a whole lot and individualize the care to that individual. If he merits natural cycle IVF, after all consultation, talking, investigation, then of course you go for natural cycle IVF. But if it's the conventional one, based on all the education and explanation that it's befitting to the client, then of course the natural cycle, the conventional IVF takes place.
Okay.
Yeah.
Let's talk about success story. I'm sure we don't have a lot of time, but if we could just wrap this up. Well, I'm interested in success story because I'm all about results.
Okay.
And it's like when I'm watching a movie, I always want to get to that part where there is happy ending.
Okay.
So based on what you've observed so far in your hospital, which of these processes seems to have generated positive results so far?
Yeah, in my opinion, and from what we have observed, they all have generated a very positive outcome. Yeah. And we have a lot of people doing more of the conventional IVF, because in my facility, we see people in the category that require donation a lot. And if you're doing egg donation, there's no way you could go natural cycle IVF. So we do more of embryo recipient or egg donation kind of IVF. Then, of course, you have a lot of people who are in the category of assessing the conventional kind of IVF. The natural cycle IVF just had resurgent recently, especially with the downturn of economic indices. So a lot of people don't have money to go through the conventional IVF, especially in this part of the world where healthcare is paid from the pockets and not by insurance. So natural cycle IVF, it's coming gradually, and you have a whole lot of people in the category to accessing natural cycle IVF. So they're all very successful. But one very striking point about the natural cycle IVF is implantation rate. Okay. Implantation rate is extremely high compared to conventional IVF. And that's because of what I said initially. There's no so much hormonal challenges on the woman. Okay. Everything goes as smoothly as it goes in the natural physiological situation of a reproductive cycle. So high rate of implantation. Of course, the down part is a high rate of cancellation, because often you may just get a bad egg. Of course, when a woman is 37 years, for instance, and she's producing eggs, 70% of the eggs are already bad in her. So if she's producing egg, there is 7/10% chance.
So it doesn't matter whether the woman is
a bad egg.
What if she eats healthily, she exercises regularly?
It is not
Does that not have a bearing on it?
It's not a function of how healthy a woman eats. Although the health of the eating habit actually have effect on the eggs, because it's also observed that those that do a lot of processed foods, junk food, have poor quality of eggs. But that's one factor on its own. But age is one of the most important factors in this regard that affects the quality of eggs. And if it is as a result of age, there's hardly anything you can do to alter the quality of those eggs. So chances are that you produce more bad eggs than good eggs. So if a woman is producing one egg at the age of 37 or 38, the high chances that it's likely going to be a bad egg. And if it's a bad egg, what do you expect? It's definitely going to be failure. The failure is not because she did natural cycle IVF. The cancellation is not because of natural cycle IVF. It's because of the natural process of aging that all humans go through. Maybe this will be different when we get to the era of life that we're talking about, the eternal youth, where people are going to have the ability to live for a very long time. This may be a little different because aging may be stemmed or stalled at that point in time. But with what science can offer right now, aging is very important.
Okay.
Or very important. So whether conventional or natural cycle IVF, implantation, failure, success comes in all the ways. But then it's very striking, the implantation rate with natural IVF.
And yet again, just when the discussion was getting quite interesting, I'm made to know that, to understand that time is once again on our side. Well, as usual, we've been having an interesting conversation with Dr. Ken. I must say I learned a lot. Thank you for being here.
Always, thank you.
It's a pleasure to spend this beautiful day with you. Please don't forget to subscribe to this channel. Do have a wonderful day. Bye.